join. I'm so excited to have you here. So welcome, welcome, welcome. It's 7 already and we'll get started immediately. We're not wasting time. We're not waiting for anybody. It's 7 and it's 7. So welcome once again. Thank you very much for joining me. Thank you for joining me today. Thank you for making this day memorable for me. And thank you too for giving yourself to learning, right? Thank you for giving yourself to learning. Thank you for giving yourself to, God and to all He has to do. So as we begin this webinar, we begin it in God's name. We begin in the name of the Father, the Son, and of the Holy Ghost. Thank you again for joining. My name is Clara Ezichukwu Ezekwibe. I'm a physiotherapist and I'm also a certified counselor and psychotherapist. But today I'll be speaking mainly as a counselor. I'm not in the hospital today. I was speaking mainly as a counselor. So thank you very much again for joining, and we'll get started right away. If you have any question along the line, do well to just write it down. We would have a time for questions. We would have time for questions. So if you have any questions, some things you aren't sure of, you can do well to write it down. We'll join in. We'll be able to tend to questions when we are done. So thank you again. Yes, our topic today says identifying emotional trauma. But for the sake of this webinar, I will be using the psychological trauma now. We'll be using psychological trauma. That's what we'll be going into. And I will definitely take out my time to explain what it means. Okay, so when we talk of emotional or psychological trauma, what is it? Right? It's an aspect, it's a topic that people don't usually talk about. People feel, it's okay. When you are sick, it's easy to say, I'm not feeling so well, let me seek help. But when a person experiences a trauma now, especially emotional, people believe you should just huddle it in. Oh, you're a big girl, or oh, you should sort yourself out. It's not a big deal. But today, by God's grace, we'll speak. If once God gives us the utterance, we would speak. And I know He will. He has already given us. So thank you again for joining. So emotional trauma or psychological trauma, they are both the same thing. Yes. In generally, for everybody, we believe that emotional trauma is the same as psychological trauma, right? So for this webinar, I'll be using often psychological trauma because it encompasses the whole thing. Yes. So emotional or psychological trauma, what is it? It is, I'll be giving the definition, then later on, I will be able to explain better. I'll be able to explain better. It is an overwhelming experience. Listen to the word. Emotional or psychological trauma, it's an overwhelming experience that may not involve physical injury, right? It keeps the person feeling unsafe, unsure, or in a place of helplessness. So listen to it again. Psychological trauma is an overwhelming experience. So when we say something is overwhelming, it goes beyond the person's control. The person can't seem to contain what they feel at that moment. So it is an overwhelming experience, now negative experience in that leaves a person, okay, that usually don't come with physical injury most times, though it can come, but it don't come with physical injury most times. It leaves the person feeling unsafe, it leaves the person feeling helpless, and leaves the person with several emotion, anxiety, or depression. So you've experienced a psychological trauma if you've gone through an experience, a negative experience at that during the process, you at that moment you do not have control over over what your emotions, even over the way you think at that moment. And at the end of everything, it leaves you to be in a state of helplessness. You just feel as though you are lost, you are no longer in yourself. And the impact of psychological trauma is vast. The impact can stay years, it can stay months, or even for a lifetime, depending on the severity, depending on how the person that has experienced it is able to manage it. So when we talk of the impact of psychological trauma, it affects, in severe cases, it affects the brain function, which is usually the worst part of it. Or you've said people that experience one or two trauma and probably they begin to have one or two, cognitive issues because they can't take. So people's experience or people's the way they respond to things is not the same. It's usually vice. And one thing also you need to know is that the effect or the level at which a trauma impacts someone is depending on three things. The first is the severity of the trauma, right? Or the severity of the activity. You won't compare someone that had a rape once. Now it's also a traumatic experience quite a while. than compared to someone that lives with an abusive parent, or an abusive, maybe someone that is being sexually abused by either of the parents, or maybe either of the sibling or a family friend or anything. They are both different. Now, both of them are going through sexual assault, but this person more like the frequency is much, while this other person was a one-time experience. So the severity of trauma is depending on what the level of exposure, right? The level of exposure, that's the first thing. Second thing that impacts the way a person responds to trauma is their personality. Personality plays an important role. The way an introvert would respond to something is totally different from the way an extrovert would respond to something. That is just it. So our personality plays a role in the way we respond to trauma. And the last, or not the least, is the help that a person gets. So what is the support you're able to get at that moment? The support the person is able to get at that moment impacts on the way that they respond to trauma. So we've already been able to give an overview of what psychological trauma is, and also the effects, right? What are the effects? What are the ways? What are the effects? How does it impact on a person? We're able to highlight that the level of exposure, the personality of a person, and finally, or the personality of a person, and finally the support that they get plays an important role. But when we come down to, we are going down now to the forms. What are the different forms? What are the types of psychological trauma? Because some persons may be like, I'm experiencing this, I'm experiencing that. Is this part of it? Is this not part of it? It's very important for us to know what are the forms, how does it come, and how does this different forms affect a person? How does it, if you experience an acute trauma, is it the same as experiencing a chronic trauma or a complex trauma? In defining the different types, we have three types, which are the acute, the chronic now, and then the complex. So we have the acute, the chronic, and the complex type of trauma. The first thing you need to know that an acute trauma is a trauma that has, that's the repetition is just a one incident thing. So it happened just once. And sometimes persons that experience this form of trauma, they usually they can heal on their own, with little effort, or sometimes along the line, so they can also heal on their own. For a person that has experienced a chronic trauma is a trauma that repeats over and over. So it's a repetition something. Today it happens, tomorrow it happens, or maybe in 1 month time it happens. So take for an instance, right, a girl child now that is being sexually assaulted. It happens maybe a week, the next week it happens. So it just keeps coming. This person has experienced a chronic trauma because it's no longer a one-time event. And the final is the complex trauma, right? Now, the possibility that a chronic trauma will get to a complex trauma is just there. A complex trauma is a mixture of two or more trauma. So let me give you an instance. We have a child that came out from abusive home. Probably either of the parents physically now abuse one another. Let me give this instance, right? Probably this is a child that grew up to know that dad beats mom. And along the line, maybe when he was 7, 6, 8, 9, 10, 11, the physical abuse was no longer on the mom. It now moved to probably himself too. So he knows that dad doesn't just beat mom, but he also beats me. So that child has experienced two different forms of trauma. He has first of all experienced the form of trauma where he knows that, okay, dad beats mom, and he just feels like, this is what is going on. However, that child has also experienced a form of trauma where he thinks, or he begins to experience the physical abuse too on his own self. That is one thing that the child experiences. The child doesn't just experience that which the mom has gone through, but he's also experiencing a physical trauma. That is a complex trauma. And when we talk of the acute trauma, it can either come in form of violence or sexual assault, that's a one-time experience, or a life-threatening event, right? Or a life-threatening illness. Most time when people have a life-threatening illness, it's usually an acute trauma, and sometimes they can easily heal over it, right? Why another one again is the loss of a loved one. Grief is an important aspect of life. Most persons, at least the percentage of deaths is even on high these days. So there, at each point in time, people are always grieving, people are mourning. So grief is an important aspect of a person's life that we need to look into. The way a person's taking grief is not the same. The way people taking grief, rather, is not the same thing. Someone can be grieving, and in a week, in 2, in 3 weeks, he or she is able to get himself back, even if it takes time. Or somebody else can grieve in months, in months, and even in years, they are still grieving. So the loss of a loved one is an acute trauma, but if care is not taken, it could lead to other traumas. And of course, when you witness a violent event, these are types of acute trauma. And when we talk of the chronic and the complex trauma, the chronic, don't forget that chronic is repetition of trauma, the complex is now a mixture of two traumas put together. And most times, chronic eventually leads to complex. It's just something that grows. So it's more like you can easily, if you don't checkmate it at the chronic level, you can easily get to the complex level. That's where we have the child abuse, we have domestic violence, we have neglect. The fact that, oh, everybody's busy, mom is busy, dad is busy, nobody have your time. So you see this child grows up to just know that everybody's busy, let everybody face their life, let everybody. So neglect is an important aspect we need to look into, especially we Africans, we need to look into it. The fact that, okay, we are working, the parents are working, maybe, and the siblings don't even have time. They go to school, they come back. Neglect is an important factor that every parent should look into, and every intending parent should look into, because neglect is on the high level now. Children tend to believe, or they tend to feel like they are no longer loved, or they are not that important. Maybe the work is more important. And sometimes even when they go through things in their life, they can't share because they believe this person doesn't bother. They are just that, but they don't bother. And the next is attachment trauma. All these things are the different forms of trauma. And also we have bullying. Bullying is a form of trauma, and it's very, very important for parents to look into it. If your child is telling you, maybe, I don't want to go to school, or I don't like going to go, or this person says this person does that, it's important to you as a parent to look into it. Because the child grows up to know that, probably he's been bullied for maybe the way he looks, or the way he talks, or his physique. So it's important for you as a parent to make that child know that the way you look is okay, or maybe the way you talk is okay, or if you're having any sickness now or anything, it's okay. It's very important for a parent to encourage their child, especially when it comes to bullying. And we also have the psychological, the physical, and the emotional abuse too, or even the sexual. All of these are under. The last form of complex or chronic trauma that I'm going to point out is over strict parents. Now, over strict parents comes from a place of trauma. A parent that is overly strict with their child now, or with their children in quotes, is a protective mechanism that these persons use. However, they don't know that they are hurting somewhere. So let me give you an instance. Now, it's very good to discipline your child. Discipline is an important part of growth. It's very, very good to discipline your child. But the first thing you need to understand, when a parent becomes overly strict, maybe they monitor their child, the movements, the activity, they're telling you, don't do this, you don't have to go there, you don't have to go there. You just know that something has gone on somewhere. So it's either they are trying to protect you from not doing something, or they're trying to, or there's something that has already played on. Let me give an instance, right? So we have these two couples that maybe after a while, either of the partner left. Let me use for instance now, probably the mom left and the dad is being left to take care of the children. So this children goes up and they believe that is saying, don't do this, you don't have to go there, you don't have to go there, you have to stay in a particular place, you have to come up by this time. Even when they're in school, could even see that dad coming to monitor them. Now, he's being a loving father, but he's also crossing boundaries in the sense that he may believe that, okay, if I should leave those children to live their life, they can easily leave me, or they can, one day I'll wake up, I won't see them again, just like probably my spouse did, or just like their mother did. So he becomes overly protective of them. The next thing again we need to look into, if they becomes overly protective of them. Now, sometimes some persons will be like, people don't talk. Why don't people talk? Why won't you come out to share your own experience, right? It's not bad now. Come out to share your own experience. To be honest with you, it's not easy. It's not actually easy sharing experiences, because there are a lot of myths. Let me use that word now, that comes with trauma. A lot of persons feels that, what were you doing? How did you get to that point? That kind of stuff. So sometimes people think, it's easy for you to talk now. It's not that easy. That's just one thing you need to know. When we talk about what are the reasons why people don't talk? What are the reasons why people don't share their experience? What are the reasons why people don't feel they can talk? It's just that aspect that nobody is talking about. The first thing you need to know is the fear of judgment. The fear of judgment and being misunderstood is a fear that most persons that have gone through trauma, they have. They are scared. They are scared. What will this person say? What will these people see? How would they see me? What would they say? Would they say it's my fault? Would they say it's not my fault? So the fear of trauma is an important fear that people need. The fear of judgment now, judgment or being misunderstood, is an important fear. So it hinders the person. It keeps the person from wanting to speak. Another thing again is vulnerability. This person feels like, if I say this, I've practically shared everything about my life now. What's remaining for me to keep, right? So there is this place of people don't want to be vulnerable enough, or they believe, I can't get to this point with this person, or I can't say this to this person. And of course, lack of trust, especially if the source of your trauma comes from maybe a family member or someone you trusted. Lack of trust keeps a person from speaking up. They believe, if the person I can trust can do me this, then there is nobody else to talk to. They can imagine a child being abused by any of the siblings now, or by a cousin, a relative, somebody close by. The child feels that if this uncle, or even if he's been verbally abused now, probably the dad comes home to tell him every day, you're not good enough, all those kind of things. So he thinks that the child believes that if this person that is supposed to take care of me, right, is supposed to nurture me, is the one telling me I'm not good enough. Is the one, so there is nobody to talk to. There is nobody to pour out their heart. And it's an important aspect parents need to look into. Of course, the next is shame or guilt of the association of the trauma. There is just this shame that comes with it. You are just you are shy, or you are ashamed of the fact that okay, this was what you've experienced. So it hinders people from talking. And of course, we have the social stigma. We have protecting family members. So you may be protecting your family member. I don't want them to be worried. I don't want them to maybe say what is going on. I don't want them to even put their attention more on me. It's an important thing. Now, I thank God for my family. My family remains my backup, and they're all here, they're all joining in. Thank you very much. The one thing I know is that the Lord blessed me with a supportive family. However, growing up, we used to have this not a family member now, a someone within our vicinity. Okay, let me just say family friend. And sometimes he always speaks up, he always, there's just this harassing word he always said to me. And then I realized that over time, this word were getting to me, and it doesn't just go beyond the words. Because now he was making moves to kind of harass me sexually. So what did I do? The first thing I just did was I set my boundaries safe. But I realized that as I begin to grow up, now that was where it ended, but I realized that as I grew up, rather, that I had already set strict boundaries. They were just line you can't cross with Clara. They were just things that you can't just do with me, just respect your boundaries. Now, boundaries are very, very healthy. But on the extreme case, they can stop you from achieving things, or they can stop you from reaching your goal, or they can just stop you from building bond generally. So that's some of the reason why people don't speak up. So when you are thinking to yourself, but this person didn't say anything now. Why didn't she say, so that we could help him? Be rest assured that this person could be afraid of being judged. This person could be afraid of being misunderstood. This person they just don't want to be vulnerable, or this person has lost trust. So you are a colleague at work, but the person that inflicted the pain on this person is a family member. You don't expect them to bridge the gap of not trusting a family member to trust you, except when they're already healed. And of course, this person may just be ashamed to talk, right? That's why they need support. People need support. You need support. I need support. It's very important for you to have this. So when you're even persuading somebody, you're not saying anything, you're not saying anything. Rest assured that it's not easy for them to speak. When you have this at the back of your mind, you will know how to follow them. You give them space to breathe. So that is that. Now we'll be going to what are the effects, what are the impacts, right? Okay, we know there's a lot of things, it will make you depressed, it will make you sad, but really, what are the impacts of a psychological trauma? And the first impact of psychological trauma you need to understand is the cognitive impact. Let me explain. If you can draw yourself back, you understand that maybe one of the time probably you heard the news of um, the death of a family member, or someone that broke your trust, or someone that was sexually or verbally abused, or someone that is physically abused by either of the parents, the husband, the spouse, anything of any sort, right? Or a child that experienced a physical, anything of sort. You understand that the first thing that comes up, there's just this shock. You are trying to still understand, did this really happen to me, or did it happen to somebody else? Right? So that's the first impact of it. And sometimes if care is not taken, people that this cognitive impact, it stays longer than expected. It's when it stays longer than expected that it causes, or it leads to maybe one or two cognitive problem or cognitive issues. Hear me very well. The first effect, or the first impact of cognitive of a traumatic, of a psychological trauma, and the first impact of it is cognitive impact. And this is where a person suddenly find it difficult to concentrate. They find it difficult to make decisions. They find it difficult to solve problem, even to reason. Negative thoughts begin to come into their mind, right? Thought of suicide, thought of why not me just end my life, thought of I've had enough, thought of there is no need again. This is a psychological impact. And it's usually the first point of impact. It's usually the first thing that a person's experience, following the shock, following the whole stuff. So it's very, very important for you to know this. And of course, another impact or another effect of psychological trauma is the emotional dysregulation. I will explain. Emotions are a part of human beings. They are part of our well-being. They are part of our makeup. But when you see a person that finds it difficult to regulate his or her emotions, and or they find it difficult to manage their emotion, to express their emotion, it gives you a highlight, or it gives you an insight that something is going on somewhere. And it's true that there are some persons that they can't they can't regulate their emotion naturally. Probably they over express it, or they under express it. Yeah, but those persons you would know. But when it comes to someone who usually used to be jovial, who usually used to be good, but after a while, this person is just you're saying something that should be mild, the person either gets overly angry with it. It gives you an idea that what's going on. So when a person can't regulate their emotion, especially in their reactions, the way they negatively react to things, it can give you an idea, or it's part of the effect of trauma. Because when something is coming up, they are trying to look for a defensive mechanism. They're trying to say, what is this that is coming up? What is this? Hope this thing is not coming to attack me, or hope this person is not coming to bridge the gap, hope this person is not coming to bridge the wall. So it's very, very important for you to note this. And when you see it, you will better relate with that person. Then of course, the next impact of trauma is impaired self-esteem. This is a very important aspect of person's life. Self-esteem is what makes you you. Self-esteem is what helps you to know who you are. Self-esteem is part of your identity. That's just what self is part of your identity. It's that courage you give to yourself. Is that courage you have about yourself? Is that understanding, that knowledge, and that belief you have about yourself? For people that experience psychological trauma of any sort, there's just this go down in their self-esteem. It just, especially people that already, maybe they are already adolescents or adults, maybe younger adults, or people within the mid phase of their life. They just feel like, I'm not who I used to be anymore. You know, get that feeling, right? Maybe I'm no longer this, I'm no longer that. Can you imagine? So self-esteem is an impaired self-esteem or a negative self-perception is part of the impact of trauma, and is usually pronounced in adolescence. You know, the adolescence phase is a time where an adolescent now is trying to regulate themselves. They're trying to know what can fit into myself, what cannot fit into my space, right? So when something happens, it just tells them that come up from that place you are, come down. You know, that kind of feeling. It's not just palatable. Let me use that word. Of course, the next effect of it is depression. Depression. The percentage of depression now is on the high. The last I checked, research has shown that about 70% of people that experience trauma, they end up being depressed. That's a very, 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 very large number. So depression is the persistent or the consistent feeling of sadness, hopelessness, or loss of interest. Listen to this, listen to the definition. It is a persistent or a consistent feeling of sadness, hopelessness, or loss of interest in activity. And people that experience trauma, they usually come down with depression, especially at that initial point. And of course, we can have anxiety disorder, dissociation, even physical challenge that is in dealing with relationship now. So you see persons that they want to relate with you, they want to talk to you, they want to bond with you. But somewhere, somehow, they just find themselves not being able to do that. They just find themselves in a place where they can't come out of their shell. They can't just come out. They can't tell you, this is what I feel. They're just stuck up within. So these are some of the effects of psychological trauma. Now, we go to how do you identify trauma, right? It's more like the peak of our webinar. So yes, how can you identify? A lot of persons will be saying, Clara, it's been long. Maybe it was even when I was a child. No, it doesn't matter anymore. I've outgrown it, or I'm now married, or I'm now working, all those kind of things. But I want you to pause. I need you to pause. I need you to understand that you can actually identify. There are things you would see that will give you insight. And of course, the things I will be mentioning, it's not when you just see everything, you're not like, I've experienced trauma. No. The goal of it is to give you insight. And another thing again you need to understand is, especially if it has taken time, most persons find it difficult to identify if they've experienced trauma. Why? Because over the years, they have developed coping mechanism. They've been able to adapt to things. Do you understand? So when a person has developed coping mechanism, it's become difficult for them to know, or for them to identify that you are dealing with trust issue. They just say, this is the way I am. No, I don't trust somebody from this particular tribe, or no, I don't relate to somebody from this particular tribe. Because see, let me use this instance. Someone that was probably the heart was broken. Let me use a lady now, and the lady tells you, no, I'm not marrying somebody for this particular tribe. It's not a social thing now, but it's just their personal thing. When you have the ability to probe further, if you can check further, you would see that the person has maybe experienced a form of an abuse now. Maybe the trust was broken, that relationship was shattered, and you just broke this lady's heart. So she tells you, no, I'm okay. I can do everything with every kind of person, but not in this particular state, not with this particular tribe, or not even with this particular name. So you can hear somebody that says anything that pertains to this name. I don't want to mention any name, please. So if you hear people that say anything that happens to anything that pertains to this particular name, don't come in. I don't want to have anything to do with this person. These are just coping mechanisms. These are coping mechanisms that people engage. And sometimes it becomes difficult. You don't just know that something there is already locked up, but you're not sure. So yes, we are in identifying emotional trauma or identifying psychological trauma. And I said I will be using psychological trauma most of the time, identifying psychological trauma. And I've pointed out to the fact that it's difficult for you to identify it, especially if it's been a long time, you've developed coping mechanism. Probably people tells you, you're not beautiful enough, you're not handsome. I have people that you could just wake up and be like, people tells me I'm not beautiful enough, people tells me I'm not good enough. And maybe part of the way they want to cover up for that, they do everything, or they end up trying to bring people down. They end up trying to say a lot of things. So when you see somebody that enjoys bringing people down, they enjoy telling people, this is this about you, this is this about you. Oh, they just enjoy seeing the negative thing about the person. Just know that this is what they feel. That's what research. This is what they feel, but they are looking for a way to make somebody else feel that same way. Do you understand? So if I'm happy, I want you to be happy with me. But if I'm not okay with the way I feel about myself, I also want you not to be okay with the way you feel about yourself. So there are just so many coping mechanisms. Some can be healthy, some can be unhealthy, some can entail boundaries, right? And some may not entail boundaries. So it's very important for you to understand this. And of course, the first way you can identify the psychological trauma, even as an adult, somebody that has grown, even if it has stayed years, 10 years, 5 years, is the fact that you could be having flashback or intrusive memory. Flashback. So there is just this, and flashbacks sometimes can be related to a particular place. It can be related to a particular event. You've seen people that maybe in a particular day of their life, maybe every 21st of March, or maybe every 3rd of December, something, that particular day becomes a very difficult day for them. I've had people that maybe that particular day, they cannot just breathe because the memory of the activity of the event comes in. So when you see yourself having flashback or intrusive memories, flashback, you're not sure, but just something somewhere, there's something within you, your subconscious mind, that just keeps playing a particular picture. The picture may not even be clear, especially if you experience an abuse when you were much younger. The picture may not be clear, but there's just this flashback. It keeps coming, environment, sound, things, the way the thing plays out. Or sometimes you see a particular person and you're already fidgeting, right? You're already trying to, you may not be sure. You see a particular person. So once you experience flashback, it's a big pointer that something somewhere is wrong. And the next thing is avoidance of triggers. When you avoidance of triggers now goes hand in hand with boundaries. So this person already knows that no, anything that entails me being in a relationship, I'm not even doing it at all. Probably the last one didn't end well, and they were very much broken, right? Heartbroken rather. So this person tells you, no, I'm not having anything to do with this. They are practically avoiding their triggers. Avoiding trigger is good. It is healthy, especially when you are healing, because along the line you should be able to know these are my triggers, or this is the thing that triggers me. Maybe this is the thing that makes me not to be able to regulate my emotion. So ability to avoid your triggers is healthy, is good, but it also gives you a highlight to tell you, okay, this is what is wrong. Do you understand? This is what is going on. You see the fact that you don't like saying this, or the fact that you don't like people coming to your space, or the fact that you don't like maybe going to a particular place. It just gives you an idea. This is it. Do you get? So let's give an instance, right? So there is this child now that probably either of the parents left. The child just believes that anything that I thought I will have to do with, I cannot have anything to do with maybe any home that is not complete, something of that nature, is healthy. However, when you don't checkmate it, it becomes detrimental because you won't give people the opportunity. You can imagine if I and Clara said I don't have anything to do with anybody that is named Clara in my whole life. What if the person that is supposed to be my friend, what if the person that is supposed to be, the person I'm to relate with, what if the person that is supposed to be the person I'm to grow with in life bears that name? So it just kills me at that point where I can't open up to this person. I can't accept this relationship. So avoidance of trigger is a very important pointer, and it's healthy. But the goal is for you to know this is my trigger and you work with it. This is my trigger, you work with it. The next in our list, or on our list rather, is difficulty trusting people. So for people that have difficulty trusting people, it's a big pointer, because one thing that trauma does is it just helps you lose your trust. You lose your trust, even if it's for a time, you lose your trust. For people that They find it difficult. No, we are not trusting anybody. No, it's not true. It's not true. It's not true. There's just something somewhere. There's just something somewhere that tells you, you can't trust people anymore. You can't trust people anymore. So if you're finding it difficult to trust, and of course we know there's a lot of betrayal up and down, but when it's consistent, you're finding it difficult to trust family members, people. It's a big pointer. It's a big pointer. It tells you that somebody has done something wrong and nobody should be trusted anymore. And of course, you need trust to grow in life. Nobody would want to deal with people they can't trust. Nobody will want to be in a relationship with somebody they can't trust. Nobody will want to work with somebody they can't trust or somebody that can't trust them. So trust is an important aspect. If you find it difficult to trust, it gives you highlight, it gives you pointer. And of course, there's self-esteem. When there's a change in your self-esteem, it gives you pointer, especially maybe after you've experienced something and you're now finding it difficult to embrace yourself. You're not finding it difficult to checkmate yourself. You're not finding it difficult to just be who you used to be. If the point that I can tell you that something is wrong somewhere, I need you to check back. When there's a change in your self-esteem, there's now a persistent negative thoughts, negative self-talk, there is persistent shame. You've lost yourself. It gives you a pointer. It tells you something is wrong. Then of course you have mood swing, mood swing, mood swing, mood. Some people say, this is me. Oh, today I'm happy. Tomorrow I'm not happy. Today I can be joyful. Don't cross my boundaries. No, no, no. When there is a regular dysregulation of your mood swing, that's you can't a regular dysregulation of your mood rather, you can't have control, or you don't have control over your mood. It gives you a pointer. It tells you that something is wrong somewhere, because you should be able to control your mood. You should be able to control even when people offend you. You should have that control. When you've not been able to develop that control over your mood, so little things makes you happy, another thing makes you sad, it just tells you that you've lost something somewhere that you need to check back. Then the next on our list on how to, and don't forget, we are still on how you can identify. How will you know? Even if it's been long, even if it's been years, even if it's been a while, or you're not even sure anymore, or you feel like, this one is not in. We've been able to highlight quite a few. Now, the next we're going to is difficulty forming attachment or difficulty maintaining relationship. Everybody wants to be loved. That's just the truth. Everybody wants to have people they can just hold, and they can relate to, people that would hear them, people that would just be there for them. That's just the truth. We are relational being. As human being, we are relational being. We all came to earth as a product of relationship. So we are relational being. Everybody, there is nobody that's been created to live on their own, to be all on their own. There's just this point where you need somebody to lean on, you need somebody to talk to, you need somebody to share that idea, you need somebody to cry to, or you need somebody to cry with you. I'm crying, me and you will cry, something of that nature. So we are relational beings, but when a person finds it difficult to maintain relationship or form attachment, what we call the attachment theories, I won't dive into that, but there are about 4 of them. So secured attachers are people that they know they can embrace yes, they can embrace no, they can embrace next time, they can embrace let's do it again. Do you understand? So these are secured attachment. They are confident, or they are okay with being told no, and they're also okay with going ahead with it. But there are people there are about 3 different kinds of insecure attachers or attachments. These are persons that maybe over the years they've had 1 or 2 things. So there are persons that they'll view this bond, they do everything on their own. They want to make sure that nobody's helping me. Now, to some extent, I used to be that person where I just like, nobody's helping me. Let me just do everything on my own, because you feel as though you are disturbing someone. It gives you an insight that something somewhere. So you see people that they're overly lost in themselves. They are in this relationship, and they are being abused in the relationship. I'm giving an instance now. They are being abused in this relationship, but they are still there. And you can ask this lady, what's going on? Can't you leave? Can't you deserve more than this? You deserve better than this. Lady tells you, no, 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 no. It's okay. That person has been raised all through her life to believe that they are not worth much. That's just the truth. So they have been raised all through their life to believe that their goal is to make sure that somebody else is happy. So once somebody else is happy, they can now say, okay, they are happy. And sometimes it just goes to the extreme. Now it's good for you to ensure that people are happy. But when people's happiness is now at your own detriment, so you are giving up almost your life for somebody else to be happy, especially when abuse is even on it, it gives you an insight that something is wrong. So we are still on what difficulty forming relationship. or difficulty forming attachment. I won't dive into attachment theory. I already gave highlight. Then of course, the next way you can identify, the next way you can know that okay, something is wrong somewhere. I'm not sure, but something can be wrong somewhere. Something is wrong somewhere. Is changing your belief or the way you view words. So you see people that answer that this thing is scam, the way we usually call it, right? Or no, this thing again can't work. So when there's a change in your belief, when you used to believe this, but now you're no longer believing it, yes, it gives you a pointer. Now, of course, there are things that would happen. Maybe you usually used to believe this, or you have superior knowledge, or you later got better understanding. And okay, no, I don't think anything. You have reason. Maybe I don't think this works out anymore. Okay, let me try this. But when there's just a total change in your belief and you don't have any explanation for it, you just believe that this thing is not working again, this thing is not valuable again, just so that it gives you a hand. Even if it's not trauma, it tells you that something somewhere is wrong. And next is overwhelmed emotion, as I already explained. If you don't have the ability to control your emotions, it tells you as human being, you should have control over your emotion. You should be able to know, I'm feeling sad now. I'm not sure. There are even times you may be having conflicting emotions or confusing emotions, but you can know. I know that I don't understand how I'm feeling now. So when you are not able to maintain your regulate your emotions, it gives you idea. It tells you that something somewhere. It may not be trauma. Yes, just get this. It may not be trauma, but it tells you. Then the last on our list is physical symptoms. When you have physical symptoms, there are a lot of persons that following their trauma, they come down with physical symptoms. They come down with heartache, heart pain, headache, all those kind of stuff. It gives you a point. Maybe, and this physical symptom usually comes with a particular activity. So a person tells I don't want to do this because when I do this, and they are not, it's not as though they've been having medical condition. Now it's a different thing that probably you will have a medical condition, and it's another thing that a particular day. You can imagine someone that lost a family member on Christmas Day. So automatically, the 25th December becomes, instead of it to be a day of celebration, joy, it becomes a day of sadness. They see that day, the memory comes back. They see that day, the idea comes back, and they're telling you, I'm having pain, I'm doing this. Physical symptoms are pointed, especially when they are unexplained. Especially when they are unexplained. Now, we'll be discussing on what is God's will. What does God have? What is God's will? I know there's a lot of persons that are like, I'm not angry with God's will. He was there when I went through all this. Just trust me. What is God's will? What is He saying? What is His will? You've experienced this trauma. Like, what is His will concerning your life? What is His will concerning what He has written down for you? I want you to understand that I started getting understanding. I started understanding that, wow, God actually wants the very best for me, and I'm not going to take anything less than that. The very best that He wants to give to me is what I want. The fulfilled life, the rich life, the life that is full in all things is what I want to get. And that should be the same thing too you want to get. So when we go to John 10:10, I'm going to paraphrase the second one, or I'm just going to read it. He said, I came that you would have life and have it in abundance. I'm using the Amplifier. Amplifier said, to it's full till it overflows. When I saw that scriptures, I'm like, I'm not certain for anything less than everything that is full, everything that overflows. So even when you've experienced trauma, God is still saying, the reason I came, the reason I'm here is for you to have it in a life in abundance. And there are things that could happen. We live in a world that is wicked, right? So you may be asking, but where was God when all this happened? Trust me, there are things that he sought for a way to take them off you, but the environment, the heart of man is desperately wicked, right? But you've experienced it. I'm telling you today that He says that He came that you will have life and have it in abundance. So it's full, till it overflows. So embrace that. Embrace it. Let it be your own decision. I can't settle for less than what I've been given. I don't know if you understand. I can't settle for less than what I have been called to have. When you have that, you understand that your healing entails your spirit, your soul, and your body. And then, of course, another scripture again that gave me the understanding that God actually entails the best for me. Even when I've gone through trauma, I've gone through things, is 3 John 1 verse 2. He says, beloved, I'm trying to read. So he says, beloved, I pray that in every way, and in everywhere you may succeed, you may prosper and be in good health. He mentioned succeed, he mentioned prospering physically, just as I know your soul prospers. Do you understand? He says that in all things, there are persons that believe that, okay, I'm okay, physically, I'm not having anything going on, health-wise, they're okay. And then even they're just their life, they're okay. But they just know that they are stuck somewhere. But they feel I can patch my life. I can be okay with this. Trust me. He says that he believes all things. So it means that you are okay, your spirit, you're okay, your body, everything that pertains to your body. You're also okay with your soul, everything, your intellect, your psychology, your emotions. That is God's will for you to be complete, for you to be whole, for you to be healed. Because if you're not complete, if every piece is not put in together, you will find it difficult for you to live your life to the fullness of it. You will find it difficult for you to maximize your potentials. Do you understand? You find it difficult for you to just do some things because there is a part of you that is not yet full. So it's not just even about you healing now, it's about you living your life to the fullness. You could be a Christian, but yet you still know that there is just this part of you that is locked up. And if you're not healed, you won't be able to live the fullness of it. Also, it's very, very important that you heal. It's very, very important that you accept it. It's very, very important that you understand that God wants the very best for you. He wants to heal you. He said he has come that you have it. And in abundance, so nothing lost, nothing short of what he has come to give to you. So have this in mind. When you have this in mind, you understand that your healing is not just about you. It's not just about me and Clara. It's about what I've been called to do. It's about the people that are connected to my life. It's about the people that will also grow from my life. It's about me achieving the best of my life. It's about me achieving the best of what God has called me to be, right? So you need to heal. You need to embrace it. You need to be able to work. You need to make that decision. And I'm glad that you made the decision to join today because it's a first step to good. There's nothing like knowledge. Knowledge is an important part of our life. Now, what is the way forward? We've been able to highlight what is psychological trauma. I'm ending with this, right? We're able to highlight what is psychological trauma. We're able to highlight why don't people talk? Why don't people talk? You'll be asking, well, this person didn't speak up. Trust me, there are a lot of things that goes on in that person's mind. We've also been able to highlight what are the effects, what are the impacts when a person goes through this. What does it do to that person, right? We also highlighted the loss of self-esteem, psychological impact, the physical impact, the dysregulation, difficulty, trust. They are all part of it. And also, we've also highlighted what is God's will. Yes, we've highlighted what is God's will. What does God have to say? What is God's will? We also highlighted how to identify it. So even if it's happened years, it happened so many times, you can look into yourself to say, okay, this and this and don't forget that what I mentioned, of course, I'm not exhausting the list. What I mentioned, they are just hints. They're to give you idea on identifying it. They are to tell you something is wrong somewhere. It's not left for you to seek further help. It's not left for you to stay within yourself to check. So now we'll go to the final part of this section, which is what is the way forward? You've been able to learn what trauma is. We'll explore a lot. What is the way forward? How can I begin my healing journey? How can I just get off this? How can I begin? That's just the question. The first step towards healing, the first step towards healing, the first step towards wholeness, the first step towards achieving the best of your life is acknowledging and validating your feeling. That's the first step. The first step you need to know, acknowledge and validate your feeling. Because most times, a lot of persons live in doubt. You just believe that, oh, it can't happen to me. No, I wasn't the one that was affected. Or no, this is not me. Or no, it can't happen. So a lot of persons live in doubt, especially people that experience trauma. They are doubting, or they just believe that it didn't happen to them, or it wasn't them. The first thing you need to do is acknowledge and validate your feeling. Okay, yes, maybe I was born from an abusive home, or I had abusive parents, or maybe I was assaulted, or that's sexually now, or maybe I lost a family member, I lost the parent, my parents divorced, or I had breakup. Accept it. Know that even if they are your fault, even if they are not your fault, and most times trauma they are not usually the victims from. They were just victims. You are just a victim, right? At any case at all, you're just a victim. You are just a victim. That your parents separated while you were still young. It's not your fault. It's not your fault that probably either of them left. You are just a victim. You're just a child. There is nothing. There are persons that they still feel they are not sufficient enough because maybe either of their parents left, or that probably people tells you you're not beautiful. You are whole. You're okay. So when you acknowledge and validate your feelings, it helps you to know that this is what I'm going through. This is, It helps you to understand yourself. And it's because you can't forge ahead if you don't know this is where I am. So accept it, validate it, recognize that this is the emotions I'm likely to have. Recognize that, okay, these are some of the bias I may have about life. When you accept it, it becomes easy for you to heal, for you to talk about it. The next on our list is seek support. Now, of course, there are two kinds of supports. There are the professional help and seek support from family members, friends. Don't just stay alone. Seek support, seek help. Let people know if you can. If you can't, let people know. And even if you feel maybe your source of trauma is from the trusted friends, because somebody will be like, Clara, no, they are even distrusted friend, I can't seek support from them, then seek professional help. Seeking professional help is very important, because you are talking to somebody who, he or she is not within your circle. Okay, he or she is not your brother, he's not your sister, and he or she has probably has been trained, not even probably, he or she has been trained, or he or she has had experiences too. Do you understand? But when you seek professional help, you're speaking to someone whose ultimate goal is to help you. You're speaking to someone who just wants to listen to you. You're speaking to someone who wants to understand this. And a lot of times when you seek professional help, either through counseling, through therapy, or through any professional help now, when you speak, they even help you to see that there are other aspects of your life that has been there you don't even know. So we've said acknowledging and validating your feelings, right? And seek help, support from families. Let there be people around, support from families, your network, your friends. But even if you think you can't, seek professional help. It helps a lot. And professional help is the I don't want to use the word surest way, but it's the best way for you to heal. Because you're talking to someone who doesn't just have the knowledge, but he has the experience and has the desire to help you, has the desire to listen to you. Because I know you want to be, you want to talk, right? You want to be listened to, you want someone to understand you. So please and please seek professional help. Then, and seeking professional help, it depends. There are no two, as I explained earlier, there are no two traumas that are the same thing. No two persons goes through the same experience. So what a professional help does, or what counseling, or what therapy does, that they help you to map out your own thing. And just as the way you have drug prescription, right? Something that just tells you this and this, and it help you to map out your own thing, something that suits you, something that works, something that fits your skin, something that is okay with you. Now, some persons may say, okay, some persons may listen to this and they feel or they believe, okay, but before I seek professional help, before I do this, what can I start doing? How can I start helping myself now, today, at this moment? So there are self-help hints I will be giving. There are self-help hints, and those self-help, they are to help you, but they are not to augment for support, because you need support, but they are to help your journey. The first thing you need to do is educate yourself, which is what you are doing now. When you educate yourself about knowledge is powerful. It helps you to understand people's perspective. It helps you to understand people that has gone through this. What, how do they react? How do they happen? Educate yourself. That's why I'm celebrating you for joining in this webinar. You're gaining knowledge. You understand that, okay, I have the possibility of maybe not regulating my emotion, right? So educate yourself. These are self-help hints. When you educate yourself, the next thing is practice self-care. Be kind to yourself. It wasn't your fault. Be kind to yourself. When the person not kind, be kind to yourself. Be kind to yourself. I don't know how best to explain this, but be kind to yourself. Practice self-help. So what are some of the self-help is meditation. Practice meditation and self-assessment. When you practice self-assessment, it helps you to know that, okay, today this was what I did, right? So you can do self-assessment. You could assess your relationship, you could assess the way you interact, you could assess your emotion. You just sit down, be honest with yourself. Today I didn't do well, or this week I didn't do well. When you do that often, it helps you. You could see trends, or you could see things that tells you this and this and this. Then what? Practice routine. I've mentioned educate yourself. I've mentioned practice self-care. And in this self-care, be kind to yourself. Be patient with yourself. Be patient and be kind to yourself. Of course, I've also mentioned practicing your routine, which could be in form of your meditation, self-assessment. Self-assessment is an important aspect of every person's life. If you must grow, you must assess yourself. If you must change from something to something better, you must assess yourself. What assessment does is it helps you to know where you're not doing it right. It helps you to know, okay, this is what, and you need to be honest with yourself when you're doing these things. You need to be very honest with yourself. Then journaling is an important part of your healing. Write. There are some persons that they can even use art. Use art, write, journal. When you write the way you feel, when you write what you believe, it helps you. It helps you to know that this is what I feel. And of course, set boundaries straight. But also in this setting boundaries, you need help to set your boundaries, because sometimes you can set extreme boundaries. You can set boundaries that becomes too strict. Let me use that word, that will stop you from achieving your goal, or that will just limit you, that can keep you in a place. And also focus on your goal. There is life after trauma. There is life after those experiences. There is life after the heartbreak, after the abuse, after the loss of a family member, after anything you're experiencing. There is life after it. Focus on you. When you're able to focus on you, it becomes easy for you to give out from your source. So focus on your goal. What are those little? This is already 2024, right? This is January. In a week time, the 1 month is already gone. Focus on your goal. Don't lean on, hey, this is what I've already done before, or this is when you focus on your goal, it helps you heal. You have a lot of things to. These are self-help, but all those things, they don't wipe out help. Seek help. When you seek professional help, it helps you. But these are self-help. These are routines. These are the things you can start on your own. On your own. And of course, the last on my list is celebrate your progress. Be glad for those little steps. Be grateful for those little things. Be grateful for the fact that you can join in this webinar, you can get this knowledge. Be grateful to the fact that at least you have someone. Just celebrate your progress. Celebrate yourself, no matter how little. Be glad, be happy with yourself that okay, well, now I cannot know that maybe this thing triggers me. Be happy with it. Celebrate yourself. When you celebrate yourself, you can easily get things. You can easily embrace bigger things. So now I conclude. I want you to remember this. It is never too late and it is never too early to start your healing journey. It is never too late. It is never too late. It is never too early. If it has gone on through years in your life, it is never too late. It's just something that happened of recent. It is never too early. The earlier the better. So please embrace this journey. Embrace the journey. And don't pull away from people. In fact, when you experience it, it is time for you to pull towards people. If you can pull towards people and embrace your journey. Be comfortable in your skin, be comfortable in who you are, and seek for greater heights, seek for greater opportunities. Thank you, thank you, thank you. And I'm so glad you joined in this webinar. We've learned a lot. We'll still have the replay. You have time to check it. You have time to listen. Of course, I know we've said so many things, right? Yes, but you will have it posted so you can still take your time to listen to it. There are things you may not know. There are things that when you are re-listening to it, you can understand better. You can get better. So thank you very, very much for joining me in this webinar. I don't know if we still have time. Let me check. We can entertain a question or two if there is. Okay. Okay. Thank you, Thelma. I don't know. Do do we have any question? I think everybody is muted, so I'll try to unmute now. Okay, please type. If you have any question, just type. If you have any question, we have about a minute or two. I'm trying to see. Do you have any question? Anything you would like to gain? Okay. Okay, I can still tell She said, what if or can someone have all of the symptoms? Okay, by symptom now, you're trying to say the effect of it. I believe that's what you're trying to say. Yeah, does it mean their trauma is overly serious? Okay. You're mentioning the effect. Well, the possibility of having all the effect, the emotional dysregulation, the psychological impact, it can be there. It can be there, but it can also not be there. It's not a general rule. But it doesn't mean your own is overly serious. It just means that you need to learn to manage it. There's nothing like somebody's trauma being overly serious because it is what you experience. It is what you experience, right? So if you find yourself having all those symptoms, which sometimes may not be the case, you can have 4 or 5, but they still give you another. But if you find yourself having it, it tells you that you really need to embrace healing. That's just what it tells you. If you can be honest with yourself to see the symptoms, to say, I have this about this. It doesn't just tell you that yours is serious. No, that's not what it is. But it tells you that okay, this is there, and you need to embrace healing. You need to maybe seek help. You need to do this. And there's something like my own is overly. My own is more serious than yours because what I feel is what I feel. What It's not your experience, it is my experience. And don't forget that part of the things that affect the effect too are our personality, support we get, and then the level or the severity of the trauma. So somebody that has all these effects, probably they are the introvert type because this person finds it difficult to heal, or there was just no support at that moment, or it's repeated over and over and over and over. You can imagine somebody being sexually abused over and over and over. So it's possible to have it. But when you have it, it just gives you an understanding that this is there and I need to seek help. That is just that. So I don't know. Thank you very much for that question. Okay, someone said, can trauma be self-inflicted? Okay, thank you very much. Thank you very much for that. Yes, somehow. Well, in that case, it doesn't really become, well, it can actually grow to being trauma. Let me give you an instance. Trauma cannot just be self-inflicted because nobody wants to inflict pain on themselves. It's built from a place of maybe what they've heard, what they think. Let me give you this instance. So what I'm trying to say is somebody cannot just wake up and inflict trauma on themselves. And most of the times it can be verbal, but there has been something going on somewhere. So let's take for an instance, there is this child that grew up to know that he's not okay. Maybe he's not handsome enough, or she's not beautiful enough, or her physique is somehow, or what she looks is somehow. It's just something there. At that point, it may just be something that the child is hearing. Or this child now grows up to tell he or herself constantly. When the person looks at he or herself in the mirror, I'm like, you're not fine. You know, you're not this, you're not that. So that cannot be a self-inflicted trauma. You get, and sometimes it comes in the form of verbal trauma, but it's usually rare. Most times people react to it than inflicting on themselves. Do you understand? So most times people react, they rather react than inflicting it on themselves. And even when they inflict it on themselves, using that word, or even when they are now magnifying it on themselves, it's usually not them. It didn't start with them. So something that has been there. So they are now embracing this is what it is. So thank you very much for that question. Do we have any other question? I don't know if you're clear, the people that asked the question. Do we have any other question, as we will be rounding up in a few minutes? Okay. Okay, someone said, okay, can insult, harsh word, mockery, social stigma basically qualify as emotional trauma? Okay, okay, okay. Okay, first, let me answer the first one. You said, can insult, harsh word, mockery, social stigma, can they be quantified as emotional trauma? Yes, they are. Actually, they are. Especially when it's repeated. When it's repeated, we call them verbal traumas. They are verbal traumas, of course, and they are a form of trauma. They are a form of psychological trauma. When you keep hearing something, you're not okay, you're not good enough. Bully, that's where we mentioned bully. Social stigma, they are a form of verbal trauma. They are now forms, and it's been classified under verbal trauma. And yes, it is trauma. So it is. That's why I keep telling parents, you should be mindful of the word you use to your child or your children now in code, because they plays an important role. You can imagine listening, you are not okay, or listening harsh, or somebody raising their voice, or people doing things. It just tells you that you're not okay. You get? So social stigma, harsh word, mockery, it is a form of verbal trauma, and it is very valid. It is very, very valid. Then the next question is, if you had complex trauma, that's of different time. Okay, let me read the question again. What if a person has complex trauma of different type and they can't pinpoint which one is affecting them? Yes, okay. When you have complex trauma of different time, you need to, the goal is for you to go back to know what was the initial cause. And this is where seeking help comes in. When you seek help, this person helps you to know, okay, this was the initial cause, right? This was the initial cause. You cannot heal from up, because every other thing that came was more like your building step. It's been rooted from the foundation. So the goal is to go back to where it started. It could even started, it could maybe start in childhood, and you didn't even know until you grow to be an adolescent, to before it starts to manifest, or even until you go to be an adult before it starts manifesting. So it's very important when you find yourself having complex trauma, something that is just so many things, there's a bit of this. It's very important for you to go back to the basics. Very important for you to know, why am I feeling? That's where you begin to ask yourself, why am I feeling this way? Why is this? Why do you understand that, okay, this is not it, but there's something that caused this. This is not it. That's the way you can understand better. I don't know if I answered your question very well, Thelma, or if you're clear. We'll take one more question if we have. If we don't have, that will be the end of it. This is already an hour and 6 minutes more, and my goal is an hour. So any more question as we round up? Any more question? One more. If there is none, we can end with it. And I really hope. Thank you so much. Thank you. Thank you for giving the audience to. Thank you for listening. Any more question? Time is ticking. 111. Okay. Yes. Now, that's just the that's true. Most it's true. Professional help now can actually be expensive. That's just the truth. It can be expensive, but there are actually still traumas that are affordable too. I mean, there are still counselors or therapy or systems that are affordable too, that are very much affordable. So you can take out time, check, look for something that you can afford, but most make sure you seek help. It will help you a lot. And then also, even as you're waiting, even as you're making decisions to seek professional help, don't forget to start with those self-help hints I have given. The self-help, start by journaling, start by being kind to yourself, start by assessing yourself, start by practicing meditation, start by being kind to yourself, then journal, then teach. When you do this, they help you a lot. When you do this, it becomes easier for you to come out. But please still see, they are very much affordable ones. You can still see. But contact them, go to their inbox, contact them, check. So that's for this section. Please, if you have any question, I believe all of us here, we are in the group chat. Okay, that is that for this. I will be ending soon. Okay, that is that for this. That is that for this season. Thank you so much for joining in. Thank you. Thank you for being a part of this. Thank you for embracing your journey, right? Thank you for embracing your healing. Thank you for accepting to come here. It's worth it. And I really, really hope you will learn a lot. I really hope you have something to say. This is what I gain. That's my ultimate goal. Thank you. Thank you. Thank you. Thank you once again. I remain Clara. I'll still leave it for a while, but I remain Clara Ezechiku Ezekwibe. I'm a lover of God. I'm a counselor. I'm the one He's shown me. Thank you for joining me today.